So it's a lot of people will come in and be like, oh, actually my tongue or the cheeks are feeling like they're burning.
Is it worth just explaining a little bit why dry mouth can be a risk to people?
Absolutely. So saliva is your natural kind of defense against tooth decay, and it's just got all the good stuff that your mouth needs in it. And if you have dry mouth, you essentially got reduced salivary flow. So your body's unable to fight against that, either inflammation when it comes to the gums or that against decay when it comes to the teeth. Something else actually interesting that we've seen an increase with menopause is getting burning mouth syndrome.
Yeah.
So it's a lot of people come in and be like, oh, actually my tongue or the cheeks are feeling like they're burning. It's quite difficult to explain why it happens, but we do know there's a big correlation between menopause and that. And what we normally recommend is going to your doctors and just having your kind of iron and zinc levels checked out. But a lot of the times, as I said, that kind of shows itself first in the dental chair rather than with the GP.
Yeah, and the other thing that I've noticed is in menopause, there are two things. People talk about osteoporosis, osteopenia, bone degradation for women, and that can affect their mouth as well in terms of the bone levels around their teeth, and I have seen that. And so we have to be really careful to ensure that we're monitoring that the whole time, to ensure that any bone loss we can manage as best we possibly can. But obviously there's other things as well that where they might be taking certain type of medication. There are certain medications that potentially can also cause a problem with bone levels in the mouth as well, and so we need to be careful to understand what their medical history is when they're going through menopause.